So I have a chapter on this subject in my first book. The chapter is called Myths and Misconceptions. There's so many myths and misconceptions regarding psychiatry and psychiatric medications. There's many. Let me try to get into them here. So one of them that's a common myth is that it takes a long time for them to work, and some people and doctors will tell you this. Well, 4 to 6 to 8 weeks, 2 to 3 months. It's complete nonsense. It's never been true. It's not true. The most of the medications I work within a week. Some of them, maybe an SSRI, might be a little bit slower, maybe up to 2 weeks. But basically, except for the medication called Lamictal, all the other ones should work quickly. And so we can make quick decisions based on quick results. And if the results are good quickly, great. And if you get early results or just side effects and not benefit, okay, we'll take that away. That's not the right one. And what else could we do? And it's a lot of that trial and error stuff. And the other myth, common one, is that you shouldn't be on them long term. That's completely not true. Some people are okay with taking them for like 6 to 12 months and then go off of them. Now, this would be probably a person who doesn't have like a strong genetic family history. Maybe someone's gone through trauma or a death in the family and they're grieving and they can't get out of the grief. And then maybe an antidepressant or two might help get them out of the grief. And so this is a person that maybe once they get past it, like a half a year later, go off them and they do okay. Now, if it's more of a pervasive, persistent issue that's been going on a long time, strongly genetic, and if it takes a combination of different medications to get it right, these are people that should stay on long term. And you know what? And I tell people, so what? I mean, they're not bad for you. They're not addictive. They're balancing your brain. They're balancing the chemistry in your nervous system. You're feeling better. So why would you want to go off them? Well, I just don't want to be on things long term. Well, so there's a lot of sometimes me just explain to people that you can try doing it, but I'm telling you, it's not going to work out well. Some people still try it, and then they find out for themselves that it doesn't work well, and then they come back and like, oh, I think I did the wrong thing. I was like, well, yeah. So that's another myth. A myth about that they're not safe during pregnancy. That's not true either. A lot of people, I've had a lot of patients take antidepressants during pregnancy. Now, sometimes if someone's on an antidepressant before pregnancy, there is potentially the role after maybe the first trimester to try to go off and see what happens. Because when a woman's pregnant, it changes things hormonally. Obviously, things are majorly changed. Estrogen levels go super high, and so sometimes neurochemically things balance. And so some women go off of it during the pregnancy and they're okay. But then postpartum, it's going to come back again, especially if they were already taking it before. But a lot of women say, when I try to go off it during pregnancy, I feel terrible. And so I have never seen one problem, like one birth defect from antidepressants. So anyway, but that's a myth that you can't take during pregnancy. You can't take them during breastfeeding. That's another myth. Women can safely take, basically the medication are not actively moving into the baby. They're, so it's within the mom system, but it doesn't pass through the breast milk. So that's another myth of the breastfeeding thing. So other myths. That's probably the main ones there. Oh, that you shouldn't give them for kids and adolescents. Well, that's complete nonsense. I have a lot of patients that are below the age of 18, and if you don't treat people because of their age, because they're not 18, I call that age discrimination, that you're discriminating against them because they're not a so-called adult. Well, there's sometimes kids who have really bad mood disorders, and some of them start early on, and the kids are terrors. Some of these kids are terrors, and some of these kids might be early bipolar people, if they're really like throwing chairs at school and causing disruption, and then that can happen with some kids. And medication can be really helpful for the kid, the parents, the teachers, the other kids that can really get them better. And ADD, I treat a lot of ADD, And so kids can take AD medication safely even at younger ages. Usually in AD, most doctors don't start treating until at least 7 or maybe like second grade or so, but it's around there. And again, a lot of mood disorders like anxiety and depression start at puberty because of the first major hormonal change in life. And so a lot of patients, when I get a history from them and when they're adults, they go back to like, yeah, I really started back in middle school, all right, end of elementary school, middle school, early high school, right, in those years. And then sometimes it just keeps going. It just starts there and just keeps going, which is very common. And so that's because of the hormonal change. And so if kids need to be treated, I treat them. I don't worry about their age because I know how safe these medications are for kids and adolescents. That's the main ones I can think of right now. I know there's probably a few more in the book if you want to look at my first book. The second edition is now out of my first 3 books, Healing the Mind and Body. I have new covers and some new content in there, especially the third book where I add new medications and I talk, updated medication information. And I just released 2 books that I'm going to teach doctors. And then I have my newest book, the one before that called The Corona Protocol. So right now I have 6 books. Very excited about going out and teaching. I'm looking really forward to that, and so that's why I put a lot of time into these 2 training manuals. So, but again, like I said, if you want to read more about this, look at my first book, the Myths and Misconceptions chapter. And anyway, thanks for listening.